The human brain is the most complex object in the known universe. It consists of around 86 billion neurons, and it comprises the essence of who we are as people. The brain can generally be divided into three functional territories: the cerebrum, which is this bulk here, the brainstem, which is the stem that emanates from the cerebrum, and the small brain, the cerebellum. A one-word functional definition for each of these functional parts would be: the cerebrum makes decisions, the cerebellum coordinates, and the brainstem keeps us alive. But there's a whole lot more to it than that. To understand the brain, we first have to understand where it is positioned within the skull. This is anterior towards the front, or rostral. This is posterior towards the back, or caudal. Up at the top is superior, also known as dorsal. And down below we would call this inferior or ventral. The brain sits in three different fossae. Anteriorly, we have the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa. The anterior portion holds the frontal lobe, which we'll get to. The middle holds the temporal lobe, and the posterior holds the cerebellum. This ramp of bone here is known as the clevis, and the clevis is the most closely articulating part of the skull with the brainstem. Specifically, as we can see there, the clevis is anterior to the pons basalis. But that's not the whole story. The brain can't just sit under its own weight because it has the texture of jello, and it would herniate through the only possible exit, which is known as the foramen magnum. So it needs to be weightless or buoyant. This is achieved through cerebrospinal fluid, which is produced from the choroid plexuses, which is a complex of ependymal glial cells and leaky capillaries. And this cerebrospinal fluid bathes the brain and keeps it afloat. Where is the cerebrospinal fluid specifically, though? Well, let's start from the outside. The skull has an external table and an internal table. That's the hard bone on the outside and inside. And in between we have this cancellous bone, which is spongy. We call this the diplo. When we're looking at that internal table, it is lined by a layer called the dura mater. The dura mater means tough mother, and that's one of the three layers of the meninges. The dura mater can be divided into a periosteal, or bony, and a meningeal layer. So it's a double layer that we treat as one. And that is lining the skull. So the dura mater sits here. And then we have the arachnoid mater, sitting next to it. And then we have a small space called the subarachnoid space, so beneath the arachnoid mater. And that space is filled with cerebrospinal fluid, as well as with blood vessels that supply the brain, cerebral blood vessels. This last layer is called the pia mater, and that lines the surface of the brain. And together, these three layers are called the meninges. These two, the arachnoid mater and the pia mater, we call the leptomeninges. Recently, there's been a fourth meninge discovered, and that is called the subarachnoid lymphatic-like membrane, and it has some role in the immune system of the brain, but it's poorly understood. Now that we understand how the brain sits within the skull, we can talk about how the brain is supplied with blood. Blood to the brain comes from two main arteries, four if you consider the left and right, so two on each side. If you imagine you have an arch in your chest called the aortic arch, and on the right side, the first branch that comes off of it is called the brachiocephalic trunk. This bifurcates into a common carotid artery, which is going straight up, and a laterally deviating subclavian artery, so the right common carotid and the right subclavian artery. The right common carotid bifurcates into an internal carotid artery, which supplies the brain, and an external carotid artery, which supplies the head and the face, excluding the brain. The right subclavian artery gives off a branch called the spinal artery, which enters the brain as well, along with the internal carotid artery. The same happens on the left, except that the left subclavian and the left common carotid don't come from a shared trunk, they come independently off the aortic arch. The point is, 80% of the blood to the brain comes through the internal carotid arteries, the left and right, and 20% comes from the vertebral arteries. Together, the internal here and here, the left and right internal carotid arteries, and here and here, the left and right vertebral arteries, form a structure known as the circle of Willis. The circle of Willis provides the blood flow to the brain and offers redundancy such that if one vessel is partially or completely occluded, there are backup options for blood supply. The circle of Willis is positioned like this in the brain. Okay, so if we take this like this, it would be sitting here, but this blown up model is better to demonstrate the different parts. So let's start on the posterior side of things. We have the right and left vertebral arteries. They form the basilar artery, which is this large artery. This basilar artery sits on the clevis of the occipital bone. But we see two branches here. These branches are the posterior cerebellar arteries, or PICA. They supply blood, in addition to other things, to the cerebellum, cerebellar arteries. What we don't see is posterior spinal arteries that would be coming off just before these posterior cerebellar arteries, and they provide a left and right blood supply to the posterior part of the spinal cord. There's also, as shown here, an anterior spinal artery that supplies blood to the anterior portion of the spinal cord. But that's kind of an aside, because we're talking about the brain. Point is, we have PICA, the posterior cerebellar arteries, the basilar artery, and then the first branch off of the basilar artery, at least in this model, is the anterior inferior cerebellar artery. So anterior inferior. Why is it anterior? Well, if we look at how it would be situated in the brain, like this, we said this is anterior, this is posterior, and this posterior cerebellar artery is behind or posterior to the anterior. But why is this the anterior inferior cerebellar artery? Because there's up here superior cerebellar artery as well. All the way along the basilar artery, we have pontine arteries that supply blood to the pons, like so. We can see in this model, this is the pons here, so these pontine arteries supply the pons. And then we see that the basilar artery gives rise to left and right posterior cerebral arteries. In my fingers here, here, and here. These supply blood to the occipital lobe of the brain. So a lesion in the occipital lobe due to occlusion of these posterior cerebral arteries would induce visual deficits. But it doesn't just stop. There are posterior communicating arteries here and here that take us to the point of entry for the blood from the internal carotid arteries. So this is kind of the junction between the posterior circulation and the anterior circulation to the brain from the vertebral arteries and the basilar artery and the internal carotid arteries, respectively. Here, we get this junction between the posterior communicating arteries on either side and the internal carotid arteries. And the result is the middle cerebral artery coming off here. This is responsible for somewhere around 50% of strokes, and it is what we typically, and an occlusion to this vessel, the middle cerebral artery, is what it produces what we call a typical stroke. So fast, right? Face, arms, speech, time. There's also a little anterior branch. This is the ophthalmic artery that provides blood to the eyes. And then there are anterior cerebral arteries, like kind of look like prongs, connected by an anterior communicating artery here. And these anterior cerebral arteries provide blood to really the medial aspect of the brain, right? So anywhere kind of falling on this down the medial side of this longitudinal fissure. So that's a quick overview of the blood supply to the brain. How do the territories of these vessels actually map? Well, right here, this is the origin of what we would say, like right here, so we can kind of plug it in. So the anterior cerebral artery, as we said, gives blood supply to this medial surface. Functionally, the medial surface, in addition to other things, is responsible for control, motor control, and sensation from the lower limbs, the lower extremities, as well as controlling the limbic system here, so kind of emotional regulation. The middle cerebral artery, we can see it kind of emanating through here and branching out, and this is all the middle cerebral artery territory. And the middle cerebral artery, again, as I've mentioned, gives us symptoms that we associate with typical stroke. So facial droop, if it's affecting specifically like this lateral aspect. From lateral to medial, we have representation superior to inferior. So this is more the face and the hands. the upper extremities. This is more the lower extremities. So like face droop or weakness in the arms. And of course it's all contralateral. We won't go into all the detail. So when I say that, it means that if the left side, which is what this is, if the left brain, the left middle cerebral artery is occluded, the right side will see the deficits. Okay. So that's the middle cerebral artery territory. Then the posterior cerebral artery, we don't really see too well on this model. Maybe a bit through here. Supplies the occipital lobe and bit of the temporal lobe as well. And the occipital lobe, as we said, is visual. And so if somebody has an occlusion of the PCA, the posterior cerebral artery, affecting the entirety of the cortex, then they might be blind in that specific, depending on the left or right side, the contralateral side. So if it's the left, the right visual fields will be lost. But there's a phenomenon called macular sparing that occurs, and that's because the occipital pole, which is this very back bit of the occipital lobe, also receives blood supply from, oh look, the middle cerebral artery. So in this case, the person would have contralateral homonymous hemianopsia with macular sparing. So you would lose all of your vision in the right visual fields except for the most acute vision. So we've talked about the blood supply to the brain, how the brain sits, the meninges, and the cerebrospinal fluid very basically. We'll talk a bit more about the cerebrospinal fluid later in regards to the ventricular system of the brain. But now we'll talk about the brain itself, starting with the cerebrum. So the cerebrum makes up the bulk of the volume of the brain, but the minority, actually, of the neurons. They're roughly 20% of the 86 or so neurons within the brain are found within the cerebrum. The remaining 80%, so around 70 billion, are actually packed into this green cerebellum, which is just remarkable. And that's because movement is an incredibly complex action, and that's what the cerebellum has to deal with exclusively, almost exclusively. So, the cerebrum, though, we'll start there. It is a complex of sulci and gyri, and sulci are the grooves and the gyri are the ridges. On the outside, what we're looking at here is called gray matter. Gray matter has no myelin. Myelin is a lipid insulation around the axons of neurons, mainly made up of sphingomyelin. And it appears white because of that fatty lipid. We can see that on the inside of the brain, here we have lots of white matter. That's white because it's myelinated, so that's the white matter of the brain. But what we're looking at on the outside is gray matter, which represents neuronal cell bodies or somas, with lots of dense connections between them, which we call synapses. Now, there are too many sulci and gyri to even count, but there are some important ones that are typically denoting areas of conserved function between brains. The brain is not the same in all people, so labeling every single gyrus would not necessarily be that effective because it wouldn't necessarily allow you to understand all brains. But for the most part, what we'll cover here are these conserved regions of the cerebrum that are important to be aware of clinically. So there's a large sulcus groove that runs from the midline. So this is the longitudinal fissure separating the right and the left cerebral hemispheres. And this deep sulcus here is the central sulcus. And it should run all the way down here, and it should cross the midline, but this model leaves a little bit to be desired. But this is the central sulcus, and it divides anteriorly the precentral gyrus, so this ridge, and the postcentral gyrus here. The precentral gyrus is commonly known as the primary motor cortex, and the postcentral gyrus is known as the primary somatosensory cortex. So this is motor control, this is sensory input and reception. Anterior to the primary motor cortex, we have the premotor area here. And in this region about here, we have what we call the frontal eye field. Around here, again, we said that the face is represented more laterally. Around here, we have an area called Broca's area. And this is the site of speech production in the brain. Okay. Now, further back, if we look like here, more on the border of the posterior temporal lobe and the inferior portion of the parietal lobe, we'd find Wernicke's area. Wernicke's area is the speech comprehension center. If you have a lesion in Broca's area, you have Broca's aphasia. Broca's aphasia is also known as expressive aphasia, deficits in the production of speech. So somebody could understand speech but not be able to produce it fluently. The opposite is true. You have Wernicke's aphasia, where you can produce fluent speech, but it's nonsensical and you can't comprehend speech that is spoken to you. Now, here, roughly here, is the primary auditory cortex. Right about here, and posteriorly we have auditory association cortex. Association cortex is specifically cortex that primarily functions for the term that's ascribed to it, so auditory, so primarily involved in auditory sensation, but integrates different senses as well. Whereas primary cortex deals exclusively with the sense of interest. So primary auditory cortex deals exclusively with hearing. The primary gustatory cortex is in here as well. Typically it's around this area here, right? And we said this is the somatosensory cortex. So around here would make sense. Okay, what else is there to know? Well, we have posteriorly the occipital lobe, and that has association cortex and primary cortex, but just pointing at it isn't necessarily that effective. I suppose I should have started off by describing the specific lobes of the cerebrum, so let's just do that quickly. We've identified the central sulcus here. The central sulcus divides the frontal lobe and the parietal lobe. This is the parietal lobe, this is the frontal lobe. This is the temporal lobe, named because it's the first, well, the overlying hair is typically the first to show signs of grayness, the passage of time. So temporal lobe. And then we have the occipital lobe back here. But how do we separate the occipital lobe from the parietal and the temporal? Well, we start medially, and we'll see that there's a calcarine fissure and a parieto-occipital sulcus that crosses the midline about here. Let's make sure this brain stays together. Then we find this about a couple of centimeters over. We find this pre-occipital notch. So the pre-occipital notch and the lateral notch, we'll say, formed by the parieto-occipital sulcus. If we draw an imaginary line between the two, which is called the lateral parieto-occipital line, again it's imaginary, and I'm forming that with my pen, this divides the parietal and temporal lobes from the occipital lobe. Now, everywhere except for the real tip of the occipital lobe, so around here, is visual association cortex, but this tip is primary visual cortex, so V1. V1 is the first stop after the optic radiations from the lateral geniculate nucleus of the thalamus. First stop for visual processing before it sends through the dorsal or ventral streams. Where what streams? Where we form an understanding of what we're looking at. That's too much detail for this video. So, we've now defined the occipital lobe, the parietal lobe, but how do we definitively separate the temporal and the parietal lobes? And for that matter, the temporal and the frontal? Well, this fissure here, fissure is a deep sulcus, by the way. We call this the Sylvian fissure, and that divides the temporal lobe from the frontal and parietal lobes. So when you put all those together, you can define the territories of the lateral cerebrum. Okay. Here is an interesting structure. This is called the paracentral lobule. It is the medial continuation of the pre and post-central gyri, so the primary motor cortex and the somatosensory cortex, and it represents this medial side, which we said is supplied by the anterior cerebral artery, and that represents lower extremities. So this is kind of the lower extremities, genitals, sensation, and control here in the paracentral lobule. Okay? Now, it's this. The gyrus you see surrounding this white structure, so around here, that is the cingulate gyrus, and on the outside, the sulcus surrounding it is the cingulate sulcus. The cingulate gyrus is a component of the limbic system. The limbic system is the emotional system of the brain. Now it's a contentious term because there are conflicting opinions as to what is part and what isn't part of the limbic system, and to what extent we can call it one discrete thing. Okay, for the most part then, we can move away from the cerebrum and transition into the deeper portions of the brain. So this white matter, we said, white matter is axons, and this white matter tract here connects the two hemispheres, the left and right hemispheres, and it's called the corpus callosum. And people with severed corpus callosum, what we deem split brain patients, and that's performed, or used to be performed, as a last resort attempt to resolve drug resistant and treatment resistant epilepsy. So this is the corpus callosum with the splenium and the genium. And then what's difficult to appreciate here is that we have ventricles around here. We have lateral ventricles in the brain. So what are ventricles? Well, ventricle is like a space. It's typically filled with fluid. And we have 4 in the brain. We have 2 lateral ventricles that funnel through the interventricular foramina, left and right, of Monroe into the 3rd ventricle. The 3rd ventricle drains into the 4th ventricle via the cerebral aqueduct, and the 4th ventricle then lets this cerebrospinal fluid, which is the fluid that fills the ventricles, out into different areas through the 2 lateral apertures of Luschka, which goes into the cerebellopontine angle cistern, and then the median aperture of Magendie, which drains into the cisterna magna, or the big cistern. What is a cistern? A cistern is a basically pocket of cerebrospinal fluid. And we said the cerebrospinal fluid is in the subarachnoid space. It's produced by the choroid plexuses, and we can actually see choroid plexus here, denoted in purple. So why did I mention all of that? Well, we have here this space where my finger would be, that is the 3rd ventricle space. And we said that the 3rd ventricle drains into the 4th ventricle, which is here, via the cerebral aqueduct, and then out through the lateral and median apertures. We won't go into too much detail. Here's the cisterna magna, where it would be at least. Okay? So, how about all of these other structures, though? Here we have the septum pellucidum. The septum pellucidum is the clear and thin layer that divides the left and right lateral ventricles. So on either side of this sheet, we would have the left and right lateral ventricles. They drain here into the 3rd via the interventricular foramina. Okay. Corpus callosum, the genium, and the splenium. Splenium is bandaged, genium is knee. That's what they mean. What is then this structure right here? This kind of junction between this white matter here and this hook in the corpus callosum. This is the anterior commissure. And the anterior commissure is a point of communication between the left and right temporal lobes specifically. The fornix is this structure here, and that has a role in the consolidation of memories. So we said that we have an anterior commissure, which is here, but we also have a posterior commissure, which is right here, and it's not shown well at all on this model. I'll put up an image that shows it more clearly. And just behind that, just posterior to the posterior commissure, we'll have the pineal body of the pineal gland. Okay, so it should be like a dot here, and then a little jut over, and then another dot here. Posterior commissure, and just posterior pineal gland. The posterior commissure has a number of functions, one of which is making the pupillary light reflex, PLR, bilateral, as well as playing a role in language processing. The pineal gland releases melatonin, which regulates our sleep-wake cycle, and that occurs in response to the suprachiasmatic nucleus which is responsive to light via projections from intrinsically photoreceptive retinal ganglion cells. Now, the suprachiasmatic nucleus is part of the hypothalamus. But what is the hypothalamus here? Well, we'll start by defining this region here. This region with this green dot in the middle is called the thalamus. The green dot, it kind of forms like the, I don't know, maybe we'd say the fried egg-like appearance, is called the green dot is the interthalamic adhesion, and it's a connection between the right and left, or the left and right, thalami. So these structures, the thalamus on either side, are not contingent, or continuous rather, aside from through the interthalamic adhesion. So this is the thalamus. What's beneath the thalamus? What's beneath the thalamus? The hypothalamus. Hypo is beneath. So this is the hypothalamus. This is the thalamus, the interthalamic adhesion. The fornix, the septum pellucidum, the corpus callosum, the anterior commissure, the posterior commissure. Okay. Now, what is happening here? Well, let's look this way. This is the most distal portion of the optic nerve. The optic nerve, the left and right optic nerves meet at the optic chiasm, where the nasal hemiretina fibers cross the midline and the temporal hemiretinal fibers stay ipsilateral. So this is the optic chiasm. The optic chiasm. And if we said there's a suprachiasmatic nucleus, so above suprachiasm nucleus, then the suprachiasmatic nucleus is around here within the hypothalamus. Now, what's not shown here is the pituitary gland, which should sit roughly where my finger is, and that is connected to the hypothalamus through a pituitary stalk. So this is where the pituitary gland would be. The hypothalamus is here, and here's the pituitary stalk. Pituitary gland can be split anteriorly and posteriorly. Anteriorly, it's an endocrine organ producing hormones like FSH, LH, etc. Whereas posteriorly, it is a neurohormone secretion center. It secretes neurohormones that are actually produced in the hypothalamus. These two neurohormones are oxytocin and vasopressin. Vasopressin regulates blood pressure. Oxytocin has a role in childbirth as well as feelings of bonding. And just for context, if we leave the choroid plexus in place, that's what we're looking at. So I will take away the cerebrum, and as we do, we reveal some additional details. Okay. If I remove the opercula, or the operculum, the frontal operculum, if I can get it back. There we go. The frontal operculum and the temporal operculum, opercula, which covers this insular cortex, we reveal kind of the brainstem and some other deep brain nuclei. It's tough stuff to follow. So, apologies for any confusion. What I'm saying when I say operculum is it's the specific portion of the cortex that when you pull it away, deep to it, we see the insular cortex. The insular cortex is this in here, and it's this extra lobe of the brain that people don't often think about. It just integrates with everything. Okay? Integrates everything. You can think of it like that. What we see here is the white matter that we've looked at before. And that's also true on this portion. And just to understand the flow of this white matter, the white matter comes from the cell bodies, it's the axons of the somas, and comes broadly from the cortex, deeper or inferiorly, and this array we call the corona radiata, or if we look at it from cross-section, we call it like the centrum centrum semioval. And then as they funnel together, they meet at the internal capsule. The internal capsule is an important structure, and if you have a stroke there, you lose motor control because these fibers, these axons, all run through there packed tightly and densely. So where's the internal capsule? Here, this kind of punctate appearance, and here. So insular cortex on either side, internal capsule. There's a bit of choroid plexus, and then optic chiasm. But then the internal capsule funnels down into white matter tracts that continue down through the spinal cord. We'll get there when we look specifically at the brainstem. We're getting there slowly. So what else is going on here? Well, maybe it's best shown here. This kind of tail-like structure. So you see how it starts up here, wraps down and around here. That is the caudate nucleus. The caudate nucleus is one of the basal ganglia. Along with the putamen of the basal ganglia, it forms the striatum. We won't go into the basal ganglia in depth today because they're not shown well on this model, because you kind of need to see them through axial slices. Here we have a representation of the brainstem and the basal ganglia. Laterally, we see the insular lobe, or the insular cortex, that is circumscribed by the internal capsule. Deep to these structures, giving punctate projections of white matter. We observe the caudate nucleus with the putamen, the tail and the head, and then reflecting that medially, we see the globus pallidi. Together, this is the lentiform nucleus. This is the lentiform nucleus, not the caudate. Pulling this off, we get the thalamus here, and these white matter tracts funnel down through to the crus cerebri, or the cerebral peduncles of the midbrain, the anterior commissure, the optic chiasm, the interlaminar confusion, the ventricles, the hypothalamus, the infundibulum, where the pituitary would be, optic nerve, optic tract, inferior colliculus, superior colliculus. But caudate nucleus, and at the tail of the caudate nucleus, we have the amygdala. That's not really shown here, but it kind of sit out like a little amorphous blob here. Amygdala is a primary component of the limbic system, regulates fear. But what we can see, let me take this away, some other structures here, and this would be the hippocampus, this medial temporal lobe structure here. This might not be particularly helpful without having your hands on, so I'm just going through it. Please skip through. Okay, now we're getting there. We're getting to the brainstem. within here, so here's the caudate nucleus, and the caudate nucleus, if we looked kind of inside here, not inside the caudate nucleus, but in this territory here, we'd see the globus pallidus externa, the globus pallidus interna, and the putamen. And those are basal ganglia. Okay. Now I think we are actually ready to get to the brainstem. We have the three parts of the brainstem are the midbrain, the pons, which means bridge, and the medulla oblongata. Okay. The easiest thing here is to start off with a medial midsaggital section, and we'll point to all the different parts and then go from there. So the midbrain, there's the generally tegmental portions of the brainstem, so the tegmental midbrain, the tegmental pons, and the tegmental medulla. That's kind of shown in this white. The midbrain also has a tectum separating the tegmental midbrain and the tectum of the midbrain is the cerebral aqueduct. And then we have the cerebral peduncles. Cerebral peduncles give the midbrain a Mickey Mouse-like appearance on axial imaging, and they're here. See these vertical lines? Those are the fibers. So the cerebral peduncles are that next step for the axons descending through the internal capsule. They funnel here, and the cerebral peduncles contain those axons, the lateral and medial corticospinal tracts. And then they continue through here, through the pons and the medullary pyramids. So this anterior portion is of the medulla is the medullary pyramids, and here's the pons basalis. Okay. And of course, supplied by the pontine arteries. So if you get occlusion of the basilar artery affecting these pontine arteries, that causes ischemia and infarction of the pons basalis, you lose all of those lateral and medial corticospinal tract neurons, which provide volitional control to the body below the head. That can produce locked-in syndrome, where somebody has cerebral functioning but no motor control, which is a horrific thought. Okay, what else? We have the mammillary body here, which has a role in memory. That's part there. And then we have the tegmental pons, as we've said, the pons basalis. But the back of the midbrain is what we want to look at here. So posteriorly, the midbrain has superior and inferior colliculi. There are 4 in total. The superior colliculi are involved in visual stimuli, so helping to make saccadic movements that allow us to build a more complete visual picture, even though we think we're just looking directly at one object. We're actually not. Our brain is making movements that, our eyes are making movements that help us understand the complete picture. And then the inferior colliculi here are involved in auditory processing, specifically localizing sounds. So when you hear bang and you turn towards the bang, the inferior colliculi are responsible for that. What we see here are let's build the whole picture up. Here, we have the superior and inferior, and then buried in here at the middle, cerebellar peduncles, which if we look from an anterior view of the cerebellum, we have the middle, inferior, and superior. So the inferior, middle, and superior cerebellar peduncles articulates with the midbrain, articulates with the pons, articulates with the medulla. And again, connections to the cerebellum, coordination of movement, specifically from each part of the brainstem. Okay. Now, before we talk about the cranial nerve nuclei that come off of the brainstem, specifically the pons and the medulla, we'll talk quickly about the things that you can find within each of the portions of the brainstem. So the midbrain, we typically think is being involved in motor control. So it contains the red nucleus, the substantia pars compacta and pars reticulata. Those are involved. Those are basal ganglia involved in initiating movement, and of course, it has the cerebral peduncles and the inferior and superior colliculi, which are less directly but related to movement. The pons, we think, has, of course, roles in autonomic functioning, including respiration and heart rate. Well, that's also the role of the medulla. We can get an idea of the functions of each of the portions when we look at the specific cranial nerve nuclei that emanate from them. So all but cranial nerves 1, 2, and 11 come from the pons and the medulla. Cranial nerve 1 is the olfactory nerve. There's left and right, so olfactory nerves. And those are considered direct extensions of the cerebrum itself. And kind of align with the gyrus rectus, which is here in the frontal lobe, frontal pole, occipital pole, gyrus rectus, occipital, and rather olfactory nerves. So olfactory nerve, you have primary neurons that have dendrites in the nasal mucosa, and those ascend through the cribriform plate of the ethmoid bone, synapsing with the olfactory nerve neurons, the secondary neurons at the olfactory bulb. And then that's what we're seeing here. Then the second cranial nerve, the optic nerves, we've looked at them here across the chiasm, then become tract, then LGN, lateral geniculate nucleus, and then optic radiations before we reach the occipital lobe. And now we get to the cranial nerves that come from the pons and the medulla. So you can hardly make it out here, but here we have the oculomotor nerve, cranial nerve 3, so here and here, just at the superior pontine sulcus, which is this, and here's the inferior pontine sulcus, so that's kind of dividing the pons from the midbrain and the medulla. So here, the oculomotor nerve provides innervation to all the muscles of the eye except for the lateral rectus and the superior oblique muscles. which are innervated by their own cranial nerves. It also innervates it provides parasympathetic innervation to one of the two muscles of the iris, which is constrictor pupillae. The dilator pupillae, which is the other muscle, is innervated by sympathetic fibers, which come from elsewhere. So oculomotor nerve is responsible for constriction of the pupils, and that's what we call that meiosis if it's abnormal. And if you have destruction of the oculomotor nerve nucleus, which is again here, you can get a Westphal pupil where you get abnormal dilation of the pupils due to unopposed sympathetic flow causing unopposed contraction of dilator pupillae muscle without oculomotor nerve functioning to cause contraction of constrictor pupillae. So you get dilation of the pupils. That's mydriasis. It's also seen in deep brain injury if you get like a supratentorial mass, which is above the tentorium cerebelli, putting pressure on the brain, compressing the oculomotor nerve. It effectively does the same thing, and that's why we see mydriasis in people who have suffered severe traumatic brain injury with rising intracranial pressure. That can also lead to a sign called coning, this intracranial pressure, and that's where the cerebellum, the tonsils of the cerebellum, herniate through the foramen magnum, and that is a sign of impending death due to compression of the brainstem, which is responsible for keeping us alive. That's oculomotor nerve 3. The weirdest origin of any cranial nerve is cranial nerve 4, the trochlear nerve, which wraps anteriorly and supplies the superior oblique muscle, which is responsible for intorsion of the eye, which is useful when you roll your head. Superior oblique will try to stabilize the eye only to a certain point before your vision tilts with your head. Trigeminal nerve, the largest origin because it's the bulkiest cranial nerve. It supplies sensory innervation to the face. There are 3 branches: the ophthalmic, the maxillary, and the mandibular. And like this branch 1, this branch 2, branch 3 comes through the foramen, or the superior orbital fissure, the foramen rotundum and foramen ovale. Here, here, and here. This isn't actually a drilled hole in this model. It also, the 3rd branch, so cranial nerve 5-3, or the mandibular branch, supplies the muscles of mastication, the masseter, temporalis, the lateral and medial pterygoids. Now, cranial nerve 6 is right at the inferior pontine sulcus, right there. And that supplies the lateral rectus muscle, and it's responsible for abducting the eye, so looking this way. Cranial nerve 7 and 8 are close to each other. 7 and 8. 7 is the facial nerve. 8 is the vestibulocochlear nerve. Vestibulocochlear nerve provides auditory and vestibular sense. The facial nerve innervates the muscles of facial expression, as well as provides taste, gustatory sensation to the anterior 2/3 of the tongue, while the trigeminal nerve supplies tactile sensation to that anterior 2/3. The glossopharyngeal does both tactile and gustatory sensation to the posterior 1/3 and the oropharynx. And speaking of which, the next stop after 8 is 9, and 9, come on, is the, right here, the glossopharyngeal nerve. Now, it's in this model not shown in enough detail, but there's a separation about here, where this top smaller bit is the glossopharyngeal nerve, this bottom bit is the vagus nerve, cranial nerve 10. Okay, and the division between the glossopharyngeal and the vagus nerve and this nerve in front, anterior, is the olivary nucleus. An important thing to note about the olivary nuclei is that what we actually see here on the anterolateral medulla is just the inferior olivary nucleus, so ion. And the inferior olivary nucleus is responsible for motor coordination. Specifically, it sends climbing fibers that synapse onto Purkinje cells within the cerebellum, or the cerebellar cortex specifically. So its job is to actually send error detection signals related to motor movements. So if you fail to execute a pitch in baseball, the inferior olivary nucleus will send a signal leading to long-term depression through a pathway that I'll show on the screen, but won't go into in any more detail than this. And that effectively allows you to learn and coordinate movements. The superior olivary nucleus is located in the pons at the level, roughly speaking, of the facial nucleus, so around here. And the superior olivary nucleus, which you cannot see, it's embedded, it's deep in the pons, sends olivocochlear efferents to the ear, playing a critical role in the stapedius reflex, which protects the ear from loud sounds. And so the olivary nucleus is between glossopharyngeal and vagus and the hypoglossal nerve, cranial nerve 12. So, nice thing to remember. Olivary nucleus separates the hypoglossal nerve anterior and glossopharyngeal and vagus posterior. And then the last one to talk about, cranial nerve to talk about, is the spinal accessory nerve. That's here. It's partly derived, his root is partly derived from the spinal cord, partly closer to the vagus nerve. So it's kind of a mixed cranial nerve in the sense that you could divide it functionally into two, into a spinal nerve and an accessory nerve. The accessory nerve is the accessory nerve to the vagus nerve. So it runs with the vagus nerve and supports some of those same functions. Whereas the spinal component of the spinal accessory nerve innervates the trapezius and the sternocleidomastoid muscles. So very distinct functions. Might be better just describing the spinal accessory nerve as two different nerves. Oculomotor nerve, the trochlear, trigeminal, abducens, facial and vestibulocochlear, hypoglossal, glossopharyngeal and vagus, and spinal accessory, which the cranial portion runs with the vagus. Okay, the last thing to discuss is the cerebellum. So here is the cerebellum. What are we looking at here? Well, there's a left and right hemisphere of the cerebellum, just like a left and right hemisphere of the cerebrum. the left and right hemisphere of the cerebrum is divided down the longitudinal fissure by an outfolding of meningeal duramater called the falx cerebri. The same thing occurs in the cerebellum with the falx cerebelli, but only for the posterior third or so. This is the posterior surface and the anterior surface. The posterior third or so of the cerebellum, as opposed to the entirety down to the level of the corpus callosum for the cerebrum. So there's our anterior surface, there's a left and right lobe, or hemisphere rather, and then we can divide the cerebellum into lobes. Before we do that, we'll also just note that the cerebellum is divided from the cerebrum via another duramater folding called the tentorium cerebelli. So it's kind of between these two. And the tentorium cerebelli, if you get a blow to the back of the head, will actually push forward and cause the brainstem to push anteriorly on the clevis of the occipital bone, potentially damaging the basilar artery, which is why blows to the back of the head are so dangerous. Now, the lobes. We first have to find fissures before we define the lobes. This model does not show the cerebellum in good detail whatsoever, but there should be anterior, posterior, there should be around here a deeper groove to compared to all of the other ones you see here. So these other ones aren't called sulci and gyri anymore, as they are here. All this, the fine grooves and ridges are called folia, and they confer this large amount of surface area, allowing the cerebellum to hold 80% of the 86 billion or so neurons in the brain. So there's this slightly deeper groove here. That's what we're just going to have to imagine, but in a real cerebellum it would actually be deep, and that's the primary fissure. Anything anterior to the primary fissure is the anterior lobe. Anything posterior, including beneath, inferiorly, is the posterior lobe. But those aren't the only two lobes. And of course, there's a left and right for each of these, so 3 lobes per, and that third lobe per hemisphere, and that third lobe is the flocculo. So this is the flocculus. Nodular. So this is the nodule. So flocculonodular lobe. And there's one on each side. So the lobes are anterior lobe, anterior to the primary fissure, posterior lobe, and flocculonodular lobe. Okay. In addition to the primary fissure, we have a horizontal fissure, and then a posterolateral fissure here, just inferior to the flocculus. And then looking directly anterior, we have, here's the nodule, but beneath it, inferior to it, we have the uvula. This is the uvula. And then it's not shown well at all in this model, but we should have a small depression up here, creating an almost like circle separating this, and that circular bit, or what we're just going to point to as the top up here, is central lobule, and here is the lingula and the central lobule, and then here we have the vermis, vermiform, which means worm shaped. So here's the vermis, and these are the cerebellar tonsils. So it's a kind of mouth themed naming convention. the cerebellar tonsils on either side here, and they sit most posteriorly, and they can herniate through the foramen magnum, and that, as we've discussed, is called coning, and it's a sign of impending death. Lastly, probably the coolest name of anything we've discussed, if we take the left and right cerebellar hemispheres and we look from a mid-sagittal view, you see this kind of arborization, we might say. This is the arbor vitae, or the tree of life. The tree of life. And of course, just to confirm, this outside portion of the cerebellum is all gray matter, and the inside is white matter. Okay. Inevitably, there are details that have been left out that would be interesting to go into. Perhaps in future videos, we'll go through each component one at a time in a little bit more depth, including looking at some of the deficits that would occur if the particular areas were damaged, or looking more at the blood supply to each of the areas, maybe with some medical imaging. But for now, that's a hour-plus long overview of most of the things that will jump out to you if you're handed a model of the human brain. So, don't know if it was helpful, but thank you for watching. See you in the next video.